Hello everyone and welcome to the Ideal Body Blueprint channel, where we dive deep into the topics related to our health, our wellness, and of course weight loss. I am Jamey Cunningham-Dragosta, a PhD Health Psychologist, and today we're going to tackle a critical issue. Why do governments allow so many junk food and fast food organizations to make Americans sick? And why does the healthcare industry seem to keep us sick instead of really trying to help us get healthy? Now, this is a complex topic with a lot of layers, so let's kind of break it down. And the first layer is really, and of course, they always say follow the money. So it is the economic and, of course, the political influences. Now, somebody's got to be making money off of us, basically no matter what we do, and especially the healthcare industry. And I guess we could really kind of say there's a lot of people that grease the wheels getting wealthy in the political realm, and I'm talking on all sides of the fence here. So let's talk about the economic and the political influences. If you think about the fast food and the junk food companies, they really are major players in our economy, aren't they? I mean, there's McDonald's on virtually every block. There's fast food here, fast food there. Even during the COVID lockdowns, one of the essential industries was fast food. We had to even have our stuff delivered to the house. And these industries do create, thousands, if not hundreds of thousands of jobs. And of course, they generate substantial tax revenue. So the politicians like to spend that money. But this economic contribution really makes it difficult for governments to impose strict regulations without facing significant economic backlash. I mean, think of the politicians that they get their donors money, and they say they don't, promise the donors anything, but they do. They end up passing laws and going down the road that actually helps the donors. Well, it's the same thing for the fast food industry or the junk food industry. These industries invest heavily. They consider as a line item money that they spend in the tune of millions of dollars in the form of lobbying and, of course, I mentioned political contributions. For instance, if you go to the Center for Responsive Politics, they report that the food and beverage industry alone spent over $28 million on lobbying in 2020. Now, think of that. Why would the food and beverage industry need to lobby politicians? Don't we need food and drinks anyway? Why would they need to go to politicians and give them more money? Well, obviously, it's because they want more favorable treatment, laws that benefit them. And, you don't have to be a genius to figure out that eating nothing but fast food or large quantities of fast food and junk food isn't the very best thing that there is for us. So these lobbies for the fast food companies work tirelessly to influence the policy decisions that, bounce in their favor. And this can make it very challenging for the average citizens that want something different and want to put pressure on their politicians, or decent politicians who really want to do good for their constituents, to really enact regulations that would limit this business. Now, of course, we can't take away the consumer demand and the cultural norms. I mean, I think, I've eaten my fair share of hamburgers. When I went on a mission for my church, in the 1980s, I was surprised to go to Europe, in Switzerland and France, and one of the big, the big to-dos was the McDonald's, and Pizza Huts. And now the United States is definitely in the business of exporting sickness and disease through obesity through our junk food and fast food corporations around the world. So there really is no denying the convenience and, of course, the affordability of fast food. Now, a lot of people, when they're going to college, I being one of them, lived on 39-cent tacos at the local taco joint around the corner, or almost on any corner. So for many people, especially those who have very busy lives or limited incomes, fast food is an easy and an appealing option. And so this high demand makes it challenging for governments to restrict these choices without really causing public outcry. Now think of it. Think if a government passed a law that said no more fast food in your city. I mean, how many people, would lose their job? How many people would go berserk because they would not be able to tap into their French fries and, their hamburgers and pizza. So fast food has always become deeply ingrained in the American culture. And according to the USDA, fast food makes up, now get this, 11.3% of Americans' total daily calorie intake. So more than 10% of all the food that we eat is fast food. Now, it's part of our daily lives, from quick lunches during work breaks to family dinners on busy nights. So changing these really entrenched habits requires significant cultural shifts, which are not only complex, but they're also slow moving. But at what breaking point do we need to get as an individual with your sickness, illness, and disease to the point where maybe you have been bitten by the disease of obesity, or you're having other health issues, cardiovascular disease, you're having, cancers, you're having other issues, Hashimoto's disorders, a lot of irritable bowel syndrome. I mean, I could go on and on and on. At what point does an individual get to where they say, okay, enough is enough. My health is more important than going out and eating fast food and junk food, or having Uber bring it directly to my house. So there does come a breaking point. And if you have been there, you know what I mean. If you're close to being there, you know where I'm getting at. I personally, at one time, I've been there. I've been there, done that. But if an individual gets to a point where they come to that crossroads where they have to make a decision to get healthy, to stop eating junk food and fast food, or they're going to continue to get sicker and die an early death, is it possible that a society or a country can do the same thing? Well, of course it is. I mean, obesity is skyrocketing in the United States. Heart disease is skyrocketing in the United States. Cancer is skyrocketing. And it's really not even the United States. It's all over the world. So the other big thing is marketing and information asymmetry. So let's discuss marketing and information asymmetry. Fast food and junk food companies spend billions of dollars on advertising, often targeting the vulnerable populations like children. In 2019 alone, the fast food industry spent $5 billion on advertising. So with a significant portion that was specifically aimed at children and adolescents. Now, this aggressive marketing creates strong brand loyalty and consumer preference for unhealthy options. And those choices that we make as children and as adolescents, carry with us into our adulthood. And we continue to, we build those habits, and they're very hard to break. Until at a point we either die early, or, you come to that point where you are sick of being sick and you have to make a decision. But there's also the issue of information asymmetry. Now, what does that mean? Symmetry means equal, right? But asymmetry is without equality. So the information is asymmetric. So while nutritional information is available, it's not always easy to understand or to predominantly see it because it's not really displayed properly. So We all remember a few years ago when a lot of fast food companies were required by law to list how many calories are inside their meals. And they were forced to make healthier options because what they were giving us was so full of empty calories that people were dramatically overeating and therefore over-consuming and getting unhealthy. So a lot of studies have really shown that many people don't realize the health risks that are associated with frequent consumption of fast food because the information is not presented in a clear and accessible way. And that's what I mean by asymmetric. We have wonderful ads out there that say, you do this and you're going to be a champion. You eat this or drink this high sugar soda, you're going to be able to slam dunk a basketball. But they don't say what doing that over years or every day ends up doing to your body and to your health. Now, the other thing is that healthcare industry dynamics itself. So if we move on to the healthcare industry, we can see a completely different set of challenges. Now, I'm going to tell you just a quick reference point here of how much money the healthcare industry is. I am a disabled Army veteran. I have had quite a few surgeries, and I was injured in boot camp and eventually had to have a prosthetic knee replacement surgery. And it's one of the things that led to me being discharged from the military is because, I was so injured that even after 5 surgeries at that point, the military couldn't keep me. And so I didn't know about the benefits of the VA healthcare system. So for a couple decades, I was forced to get my own insurance. And in 2015, I needed a prosthetic knee surgery replacement. And my surgeon was a surgeon here in Utah, and I went and talked to him, and I had been going to him for months and months and months getting cortisol shots because the pain was so intense. In my 40s, he said I had a knee equivalent to a 79-year-old or an 80-year-old. But eventually, the cortisol shots didn't work, but I had to pay $250 out of my pocket because insurance wouldn't cover that every time I was going. And I got to the point where I was going 2 to 3 times a week at the very end. We were really trying to wait for the surgery as long as possible. But at the age of 45, boom, had to make the decision. Now, my insurance at that point was an 80-20 plan. And I asked the question, how much of that do I have to pay? Now, the surgeon told me that the entire price, his fee as the surgeon and the hospital costs and no rehabilitation was $92,000. So I had to come up with 20% of that out of pocket. And the insurance, if they approved it, would come up with the 80%. And what was curious is I asked him, he's an orthopedic surgery, obviously smart guy, had a great medical practice in a major hospital here in the Salt Lake City Valley in Utah. And he said his fee out of the $92,000 was $2,000. $90,000 went to the hospital. And of course, some of the hardware, was less than $5,000, but the rest of it went to the hospital. Now, think about that. Approximately $85,000 or so was to a hospital where, they were going to have to sterilize a room. There was going to have a staff of nurses and doctors. I was going to have to stay overnight, at least 1 to 2 nights. So a hotel room, the cleaning staff to clean it, prep it, and clean it when I was gone. But does that really come to $85,000? And that was in 2015. So the answer was absolutely not. Plus, doing my own research as a consultant to doctors at that time, I found out that the medical components that were going to go in my knee weren't even the best products out there. They were titanium metal, and there are better products out there that if I went to a different country, I could pay less money than the 20%. So 20% of $92,000 is still over $18,000. I eventually made the decision to go to India, of all places. I got a better metal, a longer lasting metal, and my flight from Utah to India round trip, 1 full month whole stay in a 5-star hotel, the cost of the surgeon, the cost of the hotel stay, and I had my shoulder operated on, $15,000. And I got a better metal. So the healthcare industry in the United States is largely profit driven. So chronic illness that's related to diet and lifestyle, such as diabetes, heart disease, generate substantial revenue for healthcare providers, pharmaceutical companies, and of course insurance companies. So this profit-driven model focuses more on treating illnesses rather than preventing them. Now, preventive care often receives a lot less funding and attention compared to treatment that can be monetized. Now, according to the American Journal of Public Health, only about 3% of all healthcare spending in the United States is directed to preventive care. This means that the healthcare system is more geared towards managing illnesses rather than promoting wellness and preventing disease in the first place. So think about it. What's the incentive of the healthcare industry to have a whole bunch of healthy people? There isn't any, because the model of how they make money is not to treat the healthy or to prevent people from getting sick. It's only when they become sick that they make money. So they actually hope that there's a never-ending stream of sick people. So the next biggest thing is the policy and the structural challenges. So there are also significant policy and structural challenges. Implementing and enforcing regulations that limit unhealthy food options is complex, and it faces substantial resistance from powerful industry stakeholders. Now, these industries have extremely deep pockets and strong influences. We talked about the lobbying that goes on, so making it difficult for a lot of policymakers to really enact and uphold stringent regulations. So one of the things that we'll be doing here in this channel is the Ideal Body Blueprint is focusing a lot on preventive care, but also giving people tips and tricks on how to contact their representatives or to start making an influence against these corporations or the healthcare industry that's only geared towards making money if we're sick. And how do we combat that? How do we fight against that? So a lot of public health initiatives that are aimed at promoting healthy eating and lifestyle changes are dramatically underfunded, and that really needs to change. And so we need to make a difference. And if you're facing sickness, illness, and disease, there are a lot of options that the Ideal Body Blueprint will offer you different methodologies to stay healthier, to lose weight, or to prevent the cancer, to prevent the diabetes, to at least give you a shot so that you're healthier going into that situation than just all of a sudden being, faced with chronic or critical illness. Now, another thing is the CDC, the Centers for Disease Control's funding for chronic disease prevention program is always being criticized as insufficient to meet the nation's needs. Now, when we were going through the pandemic, did you ever hear about preventive care? No, it was always about and only focusing on a lot of people who were sick. Now, of course, one could say that getting the shot with a vaccine helps prevent it. But in that whole situation, as many of us know, that kind of turned out to be not so truthful, was it? So we were being deceived and lied to in a lot of different areas, and the information that we were given wasn't exactly true. So without the adequate resources, these initiatives really struggle to make a significant impact on public health. So here's some possible solutions that we can really focus on. And this is what the Ideal Body Blueprint is really focusing on to get the message out there. So if you like so far what you've seen, please make sure that you like, subscribe, and share this video, and certainly sign up to get more videos. We'll be trying to put out 2 to 3 a week. But if you want more specific information on your particular health status and how you can either lose weight or focus on your mental health, then reach out to us or put a link or put a comment in here, and we'll send you some information here on how you can get involved. So here are a few potential solutions. The first one is policy reform. Now, governments really can implement policies that, and they should implement policies that promote healthier food options. This could include taxes on sugary drinks, maybe subsidies for healthier foods, and restrictions on junk food advertisements. Now, countries like Mexico have successfully implemented taxes on sugary drinks, and that happened a few years ago. And this led to the reduction and the consumption of sugary drinks and better public health outcomes. Now, if our neighbors to the south did that and had tremendous success, why can't we do that? Second thing is public education. As a health psychologist, I'm dedicated to research disease, sickness, and health, and how we can prevent getting to that state by doing all the things that we should do that a healthy person takes on a normal basis to avoid that and passing that crossroads. So public education, we need to really increase public awareness about the health risks that are associated with junk food and promote healthy eating habits that can help shape consumer preferences. So a lot of education campaigns can provide a very clear and accessible information about nutrition and the benefits of a healthy diet. The other thing that we could do is healthcare integration. Now, integrating preventive care and lifestyle counseling into healthcare systems can really help reduce the incidence of diet-related illnesses. Now, diet-related illnesses are things like the disease of obesity, the disease of cardiovascular diseases, the disease of diabetes. A lot of these are propagated by our diet choices. And if we were more aware of what we should drink and eat or not drink and eat, could either delay those diseases from happening or eliminate them from happening altogether. So this means that we need to put more emphasis on nutrition, physical activity, and healthy lifestyle choices as part of routine healthcare. The other thing is community programs. So supporting community-based programs that provide access to healthy foods and encourage physical activity can create healthier environments. Now, I know that this is a bigger challenge, but there's a lot of things that we can do in our communities. And I don't think that there's a lot of focus on that. For example, community gardens, farmers markets, heading on a Saturday morning or a Sunday morning to different farmers markets in your local area to support the local farmers. Not only is good economically for them, but often the choices that they offer are much, much better than what we get at the large chain grocery stores. And of course, local fitness programs can make a big difference in promoting health and wellness at the local level. I remember as a kid, when Ronald Reagan was in office, he had Arnold Schwarzenegger as the Secretary of Fitness. And I don't know if that was his title, so don't quote me on that. But there was a big campaign, he was an icon at that time and still is. And he promoted a lot of health and activities. And I remember, different things that were going on in my junior high regarding health and fitness. And a lot of that was coming down the pipe and it started with the President of the United States that put some focus on health. So in conclusion, there are many factors that contribute to the prevalence of junk food and fast food in our society. And the focus on treatment rather than prevention in our healthcare system creates a lot of potential. So we need to flip that and make it so that our focus is on prevention rather than treatment. And by addressing these issues through a coordinated event between our governments, between our healthcare providers and our communities, and us making those decisions, becoming aware, understanding what our choices are, who to contact, what representative should we call and say, how can our community be better organized and better healthy here. We can create a healthier food environment and improve public health outcomes. Now I'm going to put some links underneath this video so that if you want to go to the websites where I reached out and got a lot of this information, I'll put these links in the description below so that you can do this. So thank you for joining me today on the Ideal Body Blueprint channel. So if you found the video informative, please give it a thumbs up. I'm really starting this channel, and so by giving a thumbs up, a like, subscribing to the channel, will allow me to provide more content. Plus, of course, the old algorithm, if you share it, more people will see this valuable information. So let's focus on our health. Let's focus on our wellness, and let's lose weight together, and let's shape a healthier future. So we'll see you next time.